If you're confused by conflicting advice about ADHD medication online, don't worry, because most of it is noise. Today, I'm going to show you the 3 things that actually matter to get you to a steady state that I like to call all good, no bad. My name is Jonathan Murphy, psychiatric nurse practitioner, and I've been prescribing ADHD medication for a decade. You know what? I love that people do their own research. Learning is good, but there is a gap between information and clinical wisdom, and that's where most people get confused. So today, we're going to talk about what matters for everyone, what's individual for you, what's just noise, and how to know if someone else's advice is actually worth listening to. Here's what successful treatment with ADHD medication actually looks like. You found the right extended release stimulant or non-stimulant, the right medication at the right dose for your ADHD brain. You take it daily, and it always works. The benefits, they're there. And the side effects, well, there aren't any. All good, no bad. That's your stable state. And then your medication becomes the background, not the foreground. So you're not constantly thinking about it, trying to optimize it, or hack it. You take the medication and you just live your life. The goal is balance. It's calm. It's trusting the process. It's an appreciation for the now tied to your greater sense of purpose. It's predictable. It works. And it feels a whole lot better than the old way. And you still get some immediate gratification too. There's nothing lost. So if someone is speaking from this place, their experience is valid. And if they're not in this place, if they're still struggling, constantly optimizing, dealing with side effects, their advice might be about their struggle and not about what works long term. So let me break down what actually matters into 3 categories. Number 1, you got your universal truths. This is going to be true for anybody with ADHD that is on medication. Number 2, you got your individual variation, and those are going to depend upon the person. And then number 3, that's noise. So you can go ahead and tune it out. This is going to help you filter what you read online, in those scientific studies, and on those FDA labels. Let's start with what's true for everyone. If you take your medication on an empty stomach, it's going to kick in sooner. But if you have food in your stomach, it's going to slow the absorption. Whether you've had nothing to eat or the full Denny's Grand Slam breakfast, the same thing's going to happen. Your ADHD is going to be treated. However, the difference you might want to think about. If you find the come on to be a little harsh, have some food in your stomach. If you need to get that medication working right away and you're more worried about getting a good response, take the medication on an empty stomach. Now let's talk about caffeine awareness. This is going to result in about 90% of side effects for most people. Caffeine isn't banned, you just want to know what's doing what. That's why I tell people to try to skip it the first day. Once you get a sense for how the medication's working on its own, you can work in the caffeine as tolerated. Some people stop altogether, some people keep it going. Caffeine's going to be put into the same bucket as alcohol and cannabis. It's a recreational substance. So if you're taking an ADHD medication to therapeutically treat your symptoms, and then you're having caffeine on top of it because the ADHD medication is just not enough, you want to talk about it with your provider, because the ADHD medication should be enough by itself. And it's going to make you crash out a whole lot earlier anyway. So you want to take a good hard look at the impact that caffeine could potentially have on your ADHD treatment. Next up, we got consistency over time. Taking it daily is what really matters over some sort of perfect execution. If you're within a 1-hour time frame, you're doing a pretty good job. More precise than that is a perfectionist trap, and you're getting lost in the sauce. And at the end of the day, what really matters is supporting a good circadian rhythm, not so much the medication itself. Let's get into if your meds aren't working and you're exhausted. Get your vitamin D checked, and while you're at it, get your vitamin B12 checked as well, especially if you're vegan. I once had a patient that was vegan suffer B12 deficiency, which resulted in temporary paralysis, even when supplementing. It's a real neurological issue. B12 makes the myelin sheath. That's going to help the electricity fire across your nervous system, just like the rubber cord that plugs something into the wall. So if you're not eating your meat, you better get that B12 checked, and if you're supplementing, recheck to make sure you're absorbing it. Something else that really matters is your iron levels. Iron is the thing that carries oxygen in your red blood cells. Low iron means you're not getting enough oxygen, which is going to mean you're exhausted. In my mind, these are the only nutritional factors that actually matter when it comes to ADHD. They're actual deficiencies that affect your basic function. There you have it. That's going to wrap it up for those universal truths. Now let's get into the person-to-person, generic versus brand. Some people genuinely prefer brand. Some people pick a special generic, and for most people, it really doesn't matter. When you pick up your medication, take note when the color changes or if the manufacturer changes. But don't assume there's a problem before there is one. You're just going to make treatment a lot harder on yourself. You got to find your optimal dose for your ADHD brain, not someone else's. All good, no bad. That's your measure. Now let's get into what medication works. Your individual response varies. All medications for ADHD are dopaminergic, meaning they're going to provide stimulation for the ADHD brain. What medication is going to do this in the best way varies person to person. Some people do better with a methylphenidate, some do better with an amphetamine, and a much lower percent of people with ADHD are going to do best with a non-stimulant. Now let me tell you why individual variation exists. Why is it so different person to person? This is exactly why I developed the survival modality framework. The major differences person to person aren't random. They're adaptive nervous system responses. Because all of us at one point in our life sought safety outside of ourselves. So if the medication goes in your body but you're looking to find peace outside of it, you gotta look within. This is why all good, no bad looks different for everyone. You're not trying to match your medication for someone else's experience, you're trying to find what works best for you. When it comes to the survival modality framework, I did a deep dive on this, how all 8 modes might look different in ADHD treatment. Link is in the description. But here's the point. The answers aren't outside of you, and they're not in a comment section. It's about understanding your nervous system, working with your provider, and finding your version of all good, no bad. Now, let's talk about that noise. Here's what doesn't matter. All right, internet, it's time to talk about that orange juice. That's right, OJ. There hasn't been a more controversial OJ since, well, you remember. I'm guessing you've seen some advice on the internet that says don't have orange juice with ADHD medication because the acidity destroys the absorption. Well, here's what's actually true. Yes, acidic substances theoretically can affect absorption in a laboratory setting. Now here's the clinical reality. In 10 years of prescribing ADHD medication to thousands of adults, I have never had one single ADHD medication issue solved by addressing orange juice. Not one. This is the gap between pharmacology on paper and what actually matters in real life. And let's talk about that random vitamin supplementation. Apparently, people are talking about magnesium or zinc. B complex vitamins help ADHD medications work. Is that a thing? And how would you know if that's even true? Are you getting your labs checked? Sounds like theory to me. And this is different from the B12 point I made earlier. Those are going to be actual deficiencies that you can measure that affect your function. This is just supplementing without knowing there's even a problem. And I'm all for taking the medication consistently, but you don't need to time your watch to it because you're making it harder on yourself when there's really no clinical benefit. The point is to find the right ADHD medication at the right dose that you can take every single day. Set it and forget it. That's the goal. Medication just fades into the background. So if you're constantly optimizing, reading every study, and adjusting based on what you hear, you're making medication the foreground. And that's the opposite of all good, no bad. The right medication at the right dose and the right amount of stimulation for your brain. Now that's all good, no bad. So how do you filter this advice? When you see someone talking online, ask yourself, is this person speaking from all good, no bad? Have they found their stable state? Or are they in the still struggling phase? If they're stable, their experience is valid. But if they're struggling, that's something they're working through, not what works. It's about recognizing the difference between someone sharing their experience about what works versus someone that's venting about not being able to figure it out. Learn from the people who have reached the destination, not the ones that are still trying to find their way. In short, stop obsessing over the details that really don't matter. Focus on the universal truths, honor your individual variation, and tune out the noise. Because the goal is balance, even if your ADHD life remains a little bit chaotic sometimes. The bottom line is it's going to be a whole lot better than the old way. because that's all good, no bad. When you get there, you'll know, because you'll stop thinking about the medication and just start living your life. If you want to learn more about individual variation when it comes to nervous system responses, I got my survival modality playlist for you right here. And for more on medication optimization, I got that playlist for you right here. And go ahead and hit subscribe if you want to keep receiving practical strategies from a nurse practitioner who won't sell you short.